wellness revolution starts now.
Well, good day. Today we're going to be talking about an important topic that you've been seeing other folks talking about if you're at all interested in medical issues. And a lot of folks who are in the biohacking world talk about this topic. But let me just tell you some of the benefits that people often report. And just imagine, would I be interested in something that can do this? It can help me focus better. It gives me a boost in energy. It often gives me a boost in mood, motivation, yet also makes me feel calmer. Might even help me lose a little weight, reduce my appetite. Well, all of those things are available by something that is available actually over the counter. And we're talking about nicotine. Well, of course, we're not talking about smoking. We're not talking about vaping. We're not talking about smokeless tobacco. All those forms have a lot of negatives. They're addictive, and we're in no way, shape, or form encouraging you to do anything with those. But what's interesting is there are existing medical studies using nicotine, and it does have some positive effects. And the exact way to position nicotine is actually still being defined because in some ways we're still extrapolating a lot of information from some animal studies and we have some limited human studies, but I'll go over those. They're fairly substantial in their information, but they don't answer all the questions about what nicotine can and cannot do. But nicotine, of course, has been around as long as tobacco has been around. And I remember back in the day when I used to run some smoking cessation classes as a group, and I'd have maybe 30 people in it. And we'd be talking to people about why they smoke. And it's interesting, they didn't smoke for dumb reasons in most cases. It was usually because it did something for them that they appreciated, but they also got addicted to a very harmful substance. So whatever benefits they were getting were going to be vastly overshadowed by all the awful things that go along with tobacco products. Now, if you just take out the nicotine, as you can with some of the products like patches today, you can actually just talk about the benefits of nicotine. Why in the world would nicotine even have an effect on our body? You know, it's interesting. We have receptors in our body, particularly our nervous system. The acetylcholine receptors are actually referred to as the nicotinic acetylcholine receptors. And there's actually a particular subtype of that, it's not that important, that is where nicotine binds. So it essentially does a lot of what acetylcholine does. And acetylcholine is the memory neurotransmitter. It's key for helping you focus, remember. And those qualities are something that a lot of people spend a lot of time and effort trying to improve. You know, some people who are dealing with mild cognitive impairment, and they're taking a lot of these powerful medications with a lot of side effects, by the way, that in many cases will not work as well as nicotine potentially might work. You know, the evidence was so intriguing that it was helpful. Vanderbilt University did a study on individuals with mild cognitive impairment, and it was called the MIND study. They were trying to be kind of clever in the naming of it. It stood for memory improvement through nicotine dosing, MIND. And what they found is nicotine was incredibly helpful at improving their ability to recall things, even their processing speed, their ability to do things, react to information. And they tended to be able to, perform better on a lot of their tests. But it wasn't, one of the hopes was, wow, if it looks this good, maybe it'll actually alter the course of their disease. Unfortunately, it did not show that effect. It didn't slow the progression of mild cognitive impairment to things getting worse. But it did show a clear benefit while they were using it on their performance, which is part of why I like to posture in my mind nicotine as a support tool, not a primary tool, because if you're not working on the why you need it in the first place, you're kind of treating symptoms more than you are root issues. And if you keep that in mind, it'll help you place nicotine in the right place. I think a lot of us like the way we feel if we have a little bit of nicotine stimulation on board. And you probably have seen people who are podcasters, executives. They'll often reach in and put something between their cheek and gum, and it's often a pouch of nicotine, and it's being used more and more. The problem I have with using something that can hit your brain that fast is it tends to be more addicting the faster it hits your brain. the safest way to go with nicotine from where I sit is going to be the patch. And that's actually what they used in the MIND study. And again, Vanderbilt University gave 15 milligrams of nicotine to these individuals. And what was fascinating is they didn't have a problem getting off it. They just stopped it and they did fine. They didn't have withdrawal symptoms. I would have actually expected them to actually have a problem, but they didn't even after 6 months. But I love the fact that we have good information that it was safe. Now, nicotine's not for everybody, and I'll come back to that, but it's fascinating that nicotine not only stimulates the acetylcholine response, which is the focus, but it stimulates the release of some neurotransmitters that do some interesting things. You know, dopamine is one of those neurotransmitters that gets released with nicotine. And these days, a lot of people have heard that nicotine is the hormone that has a lot to do with, or neurotransmitter that has a lot to do with motivation. It has to do with drive. And people who are kind of bored often seek out nicotine stimulating, dopamine stimulating activities. And that might be something dangerous or edgy, trying to push themselves. Well, dopamine can be naturally increased through nicotine. And that's part of what makes it addicting, by the way, is if it hits the brain really quickly, that's kind of a benefit people will have a hard time resisting. It's interesting, though, it also makes for norepinephrine and epinephrine levels to go up. And that tends to give you kind of this, wake up feeling like, boy, I've got some energy here. And so you not only are alert, but you're energized. And it also can increase your own endorphin production, which is the calming effect. And there's another route to which the nicotine calms the body, and that's through the vagus nerve. There's a cholinergic pathway that is rather fascinating to me because it's not something that's emphasized very much, and we didn't know about until recently, that it calms things down. And a lot of autoimmune conditions and conditions that have to do with overactivity can be calmed down with nicotine. For example, if the vagus nerve has more output, which it does with nicotine, it actually can help calm down inflammation in our gut, and it calms down some of the response that you might be having. Say you had a mold exposure and your immune system was overreacting to that. You can actually calm that down potentially with nicotine. So we do have studies showing that. You know, it's not, most people overdose nicotine. They use large doses and they kind of bolus it, meaning they do it, they'll put it in their mouth and then they'll do it again in another hour. And that creates a lot of ups and downs, which again makes me nervous because it makes it more addicting. Whereas the patch takes about an hour, 2 hours to get up to the level, but it doesn't stay there. And if you're going to use nicotine, please treat the underlying reason why you may be needing it, but keep in mind that it's best to remove a nicotine patch in the evening when you get home from work, say, at 5 o'clock or before you leave work, because it needs to get out of your system to get a good night's sleep. If you have nicotine on board, i.e. if you keep your patch on overnight, you'll actually suppress your REM sleep, and you don't want to do that. That would actually start working against your health. But in addition to the cognitive decline that they were studying at Vanderbilt University, a lot of people use it just because it gives them that, hey, I can recall things faster. I've got a little bit of an edge here. Or it may be because they feel calmer because they're under some stress. And a lot of folks are starting to recognize that it can be used for long COVID, the individuals who have that brain fog or even other symptoms that began after a COVID infection or injection actually tend to see improvement if they use nicotine. And we know from the Vanderbilt study that they used 15 milligrams every day, nonstop, and there was no major side effects, which is very reassuring. That is not the way most people would recommend using it, though. It would be much better to start off with maybe taking a 7 milligram patch and cutting it into 4 or 6 and starting with a very low dose and just wearing it for part of a day and letting it get out of your system, because there are some things that work better if you let it out of your system so that the body can recharge and the receptors will still be very responsive. Whereas if you use it every single day, it doesn't tend to work as well. And I actually wonder in the Vanderbilt study if that's one of the things that limited the benefit that they saw. They may have kept that patch on daily, and that led to the receptors not being as responsive, and that may have led to the benefits becoming less and less. That would be an easy mistake to make because it's easy to look back over time, and we've learned a lot since that study was done. But I suspect that if people would cycle their nicotine dosing, they would have gotten even better results. But if you think about how many people would like to have those benefits without the negatives, and this is something that is a tool that can be used. Now, in my medical practice, I tend to focus on doing all the underlying treatments. And if I'm going to give something to stimulate the energy and memory aspect, I tend to use NAD with a plus sign. NAD plus, especially if you use it a little bit subcutaneously, works really well. But did you notice a common word there? Nicotinamide. Adenine dinucleotide is what NAD stands for. And of course, nicotine. Well, interestingly, our body has these receptors that actually are very much in the shape of nicotine, and that's why it was so named, but it's very useful. Some of the conditions that you would want to consider using it for could also include Parkinson's disease. They've actually looked at some studies and evidence that people with Parkinson's have less of their movement disorders when they actually have some nicotine on board. Schizophrenia actually seems to help those with schizophrenia filter out some background noise. And again, I'm not saying this treats these conditions, but it's an interesting tool that can help people who are struggling. Tourette's syndrome, people who've had the so-called chemo brain after chemotherapy, kind of cloudy, can't get the sharpness back. Nicotine could be helpful for that. The same thing would go for post-anesthesia issues too. Some people have a harder time detoxifying the agents that are used in anesthesia. Boy, this could really be useful for that. And again, I mentioned long COVID. Mold is a common issue in certain parts of the world, and this mold is famously affecting a lot of people's brain function. And now that we're doing more in the brain support area, I'm actually more regularly testing people for their mycotoxin levels, having them check their house. And there is no small number of people who have too much mycotoxins in their body. And many of these people, by the way, have no awareness that there's a moisture or mold problem in their home. So this is something to keep in the back of your mind. But as you're treating those issues, this could be a tool that would actually help sharpen up your thinking. Another fascinating way that nicotine may be used, Lyme disease, especially when it's in the brain, like the neuro-Lyme problem where it causes severe brain fog and memory issues, that can actually be improved using something as simple as nicotine. And you got to love simple answers. And it's interesting because I haven't actually recommended that specifically for people with Lyme disease, but I regularly use NAD, which is, again, shares that nicotine molecule, and it does work very nicely. By the way, one of the advantages of NAD plus is it stimulates the mitochondria to work more efficiently. You don't have that same effect with nicotine itself, at least as far as we know. But there's an autoimmune condition it's also beneficial, and it's fairly common, ulcerative colitis. And ulcerative colitis has been shown to have some reduction in some of the lesions and flares. Now, I want to contrast that with another inflammatory bowel condition. You do not want to use this with Crohn's disease. With Crohn's disease, it actually increases problems. It has to do with the way the immune system is actually involved in those conditions. But for ulcerative colitis, it can be helpful. It's bad for Crohn's disease. And on the topic of when not to use nicotine, obviously, if you're pregnant or breastfeeding, I mean, that's low-hanging fruit for talking about a place to be careful. Children do not, it can affect the way the brain develops. You don't want to be giving this to children. But it's also something if somebody has unstable blood pressure problems, heart disease, because it's somewhat of a vasoconstrictor, meaning it'll make your blood pressure go up by squeezing your blood vessels. And it's not a dramatic effect if you're dosing this properly, but you don't want to give it to somebody whose blood pressure is not well controlled. If they have any heart condition like angina, or they're just, having abnormal heartbeats, you don't want to be introducing nicotine at that point. Now, when those conditions are well controlled, that would be a different situation. But I should mention one other potential benefit that's a popular item these days, and that's weight control. We're spending a lot of money on these GLP-1 agents, and talking about semaglutide, Wegovy, and tirzepatide. What's interesting about those is the fact that it is a lot of money to help you reduce your appetite and lose some weight. Well, you don't get nearly a strong effect with nicotine, but everybody who has been addicted to nicotine and is concerned about their weight will tell you that one of their fears about getting off of nicotine, tobacco in that case, is that they're afraid of weight gain, which is indeed a common issue. And that's well documented. And what's also interesting is a small number of studies looking at this show that when you lose weight due to nicotine, it's primarily fat, not muscle. In fact, some people actually gain muscle. So that's a fascinating tool in the whole idea of how do you help somebody who wants to lose weight? This could be a tool. Now, I have to say when I say those words that it does make me a little nervous at recommending something that is so controversial, but the evidence we have is quite reassuring, and weight issues are not benign. If you're overweight, that throws off a lot, increases your risk of most health issues. And we do have reassuring information that using nicotine patches is safe. And again, unlike the vaping and the smokeless tobacco and certainly smoking, you're not increasing your cancer risk. And there is a lot of potential benefit there. It's rather inexpensive if you use it the way I'm talking about as well, because you can actually cut up these patches. There's one type of a patch that actually has a liquid inside, but the common ones that you buy, and you can actually buy some of these over the counter, are just the regular patch like you're used to, and you can easily cut it up. And you can even get the larger 21 milligram dose and just cut them up into very small patches, which could be a money-saving tool for you. So for very little financial investment, nicotine can help you get a better focus. You can improve your drive and motivation. And I'm starting to think, and I didn't list this and it hasn't been studied as much, but even for people who are having anxiety and depression, part of the things that can affect people with depression is they don't have any motivation. So you ask them to exercise and they're just like, they're kind of in a hopeless state. Well, if you boost their dopamine and they get that, oh, why don't I go for that walk? And then they start walking and they get some sunlight. They wave to a few neighbors. Before they know it, that alone is helping them between the sunshine, exercise, socialization, and they're starting to get back to themselves. So I think it could be a tool to get people who are depressed out there. And because it has a calming effect, it's kind of fascinating that, we often think of these strong drugs that are used for anxiety, like an antidepressant. By the way, that's a very habit-forming medication that you have to withdraw, get off very slowly. Yet people will often not think twice about recommending an antidepressant for someone who says they're anxious. If you step back and look at all your tools, think about lifestyle changes, I would have to include nicotine way, way, way above using something like an antidepressant, which is not naturally in your body. Nicotine is much more physiologic at bringing about that calming response. So we have some powerful tools out there, but I'm going to come back to what I started off with. When you're going to use nicotine, you should always be treating your underlying reason why you need the nicotine. Obviously, if you have a mold issue, you need to work on that. If you have an issue with having Lyme disease, you need to be treating your Lyme disease. If you have ADHD, you need to be working on that. And that often involves getting away from chemicals you're reacting to and eating real food, avoiding the processed food world, for example, is terrible for those with ADHD. For those with cognitive impairment, or those, whether it's subjective, they test normally, but they say, I just don't feel like my brain's working like it should. Or it's actually at the stage where you have mild cognitive impairment, where you actually do score a bit lower on this test. This is a good tool to use to improve your performance. My plea would be, don't use that as your full approach, because that is not changing the underlying process. Again, based on the MIND study, we don't have any reason to feel like that's the main tool to make the whole dementia process stop. You have to treat the root issues, which often includes not having enough of the hormones that stimulate brain function, having too much sugar, having insulin resistance, having inflammation, having toxins like mold or Lyme disease. But if you use it alongside of those, it's a great way to improve your health. Now, this podcast is being made in real time. I expect my podcast on this topic in a year to be different. Might be even different in 6 months, because it's actually a fairly fast-moving field. So stay tuned. And thank you for joining us today on Dr. Hotze's Wellness Revolution. We'll be talking more next time.
At Physicians Preference Pharmacy, we believe that personalized medical treatment and customized medications are the best way to help you achieve your healthcare goals. Sometimes this requires adjusting the dosage form of the medication from something like an oral capsule to a tablet which dissolves underneath the tongue. This is called a sublingual tablet. Sub meaning under, lingual meaning tongue, under the tongue. And there are several reasons why your doctor may want your medications to be custom-made into a sublingual tablet. Perhaps you have trouble swallowing capsules or difficulty absorbing medications. With sublingual tablets, you still get the treatment you need in a way that is effective for you. Tablets made here at Physicians Preference Pharmacy are designed to dissolve fully under the tongue in just a few minutes and offer an additional option for you to achieve your healthcare goals.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.